Right now, more than 6 million Americans are living with heart failure. Half of them had no idea anything was wrong until the condition had already reached a dangerous stage. Not because the signs were absent. The signs were there, often for months, sometimes for years. The problem is that nobody ever taught these people what to look for. Heart failure does not begin with a dramatic collapse in the middle of a restaurant. That is the movie version. The real version is quieter. It starts with small, subtle changes in your body that almost everyone writes off as getting older, being stressed, or just being out of shape. You get a little more winded on the stairs, your shoes feel tighter by evening, you need an extra pillow to sleep comfortably. None of it seems urgent. All of it gets ignored. And that is exactly how heart failure progresses, unchecked, silently, one dismissed symptom at a time. What you are about to hear are the 9 warning signs your body uses to tell you that your heart is struggling. I will explain what each one looks like, what is actually happening inside your body when it appears, and what to do about it. This is what your doctor does not have time to walk you through in a 12-minute office visit. The system is built for treatment, not for prevention. So let's fix that right now. Before we go through the warning signs, I need to clear up the single biggest misconception about this condition. Heart failure does not mean your heart has stopped. It means your heart has lost the ability to pump blood efficiently enough to meet your body's demands. There are 2 main types. The first is heart failure with reduced ejection fraction. Ejection fraction is simply the percentage of blood your left ventricle pushes out with each beat. In a healthy heart, that number sits around 55 to 70%. When the heart muscle weakens and cannot squeeze hard enough, that percentage drops, and less blood reaches your organs with every contraction. The second type is heart failure with preserved ejection fraction. Here the heart squeezes fine, but the muscle has stiffened. It cannot relax properly between beats, so the ventricle does not fill with enough blood in the first place. Less blood in means less blood out, even though the squeezing power looks normal on paper. Here is the part that makes heart failure so dangerous. Your heart is extraordinarily good at compensating. When it starts to struggle, it adapts, it enlarges, it thickens its walls, it beats faster. These adjustments can keep you feeling perfectly fine for months, sometimes years. That is not your heart healing. That is your heart masking the problem. And those compensations have a limit. The warning signs we are about to cover are the moments when your body has run out of ways to hide what is happening. They are not the beginning of the problem. They are your body's final attempt to get your attention. The first warning sign is shortness of breath, but not the kind you get from running up a hill or chasing after a grandchild. That is normal. What is not normal is getting winded during activities that never used to bother you. Walking from your car to the front door of the grocery store, climbing 1 flight of stairs, carrying a single bag of groceries from the kitchen counter to the table. Here is what is happening inside your body. When the left ventricle cannot pump blood forward efficiently, blood has nowhere to go, it backs up. It congests the pulmonary veins, the vessels that return blood from your lungs to your heart. Pressure builds in the lung tissue. Fluid begins to seep out of the blood vessels and into the tiny air sacs where oxygen exchange happens. Those air sacs are supposed to be filled with air, not fluid. When fluid creeps in, gas exchange becomes less efficient. Your blood carries less oxygen. Your brain registers that deficit and sends you one unmistakable signal: breathlessness. But here is the detail that makes this sign so dangerous. It does not arrive overnight. It creeps in over weeks and months, and instead of recognizing it, you adapt. You start parking closer to the entrance. You take the elevator instead of the stairs. You let someone else carry the heavy bag. You slow your walking pace without consciously deciding to. You reshape your entire life around the symptom. And because the change is gradual, you never notice you are doing it. That adaptation is itself the warning sign. If the life you live today is physically smaller than the life you lived a year ago, and you cannot point to a clear reason why, your heart may be the answer. The second and third warning signs show up at night, and they are connected by the same mechanism. The second sign is what doctors call paroxysmal nocturnal dyspnea. In plain terms, you fall asleep normally, and then somewhere around 2 or 3 in the morning, you jolt awake with a sudden frightening feeling that you cannot breathe. You have to sit up immediately, or even stand to get relief. After a few minutes upright, the breathing settles. You tell yourself it was a bad dream or anxiety. It was neither. The third sign is subtler but just as important. You notice that lying flat has become uncomfortable. Not painful, just uncomfortable. So you add a pillow, then another one. You prop yourself up at an angle, and the breathing feels easier. You assume it is a comfort preference. It is not. Here is the physiology. During the day, gravity pulls blood and fluid downward into your legs and lower body. Your heart manages that just fine because the volume in the chest is reduced. But the moment you lie flat, all of that fluid redistributes. It rushes back toward the chest. A healthy heart handles the increased volume without issue. A weakened heart cannot. It gets overwhelmed. Blood backs up into the lungs. Pressure rises in the pulmonary vessels, and fluid begins to seep into the air sacs. That is why you gasp. That is why propping yourself up helps, because gravity pulls some of that fluid back down and takes pressure off the lungs. I want you to do something simple right now. Think back to how many pillows you slept with a year ago. Compare that to how many you use tonight. If the number has gone up and you cannot explain why, that is not aging. That is your heart telling you it cannot manage the fluid load when you are horizontal. That deserves a conversation with your doctor. The fourth and fifth warning signs are closely related, and they share the same root cause. When the right side of your heart weakens, it loses the ability to efficiently pull blood back from the body. Blood begins to back up in the veins. Pressure rises inside those vessels, and when venous pressure gets high enough, fluid starts leaking out through the vessel walls into the surrounding tissue. This is called peripheral edema, and it shows up first in the lowest points of your body, your ankles, your feet, your lower legs, because that is where gravity concentrates the pressure. Here is a simple test you can do right now. Sit down and expose your lower leg. Find your shin bone, that hard ridge along the front of your leg where there is no muscle covering the bone. Place your thumb against it, about 4 inches above your ankle. Press firmly and hold for 10 seconds. Remove your thumb and look at the spot. If the skin bounces back immediately, smooth and flat, you are fine. But if your thumb left a dent, a pit that stays visible for several seconds before slowly filling back in, that is called pitting edema. That is not a normal part of aging. That is fluid sitting in your tissue that should not be there. Now connect that to the scale. If you step on the scale one morning and you are 2 to 3 pounds heavier than you were the day before, or 5 or more pounds heavier than you were a week ago, and you did not change what you ate, that weight is not fat. Fat does not accumulate that fast. That is fluid. Your body is retaining water because your heart is not circulating blood efficiently enough for your kidneys to clear it. The kidneys only filter what reaches them through the bloodstream. When cardiac output drops, the kidneys slow down, sodium and water accumulate, and the number on the scale climbs. I see patients who have been battling this on the scale for months, adjusting their diet, cutting calories, feeling defeated, and never once considering that their heart might be the reason the number keeps rising. Now I want to stop here for a moment because what I just told you is important and I need you to actually do something with it. Swelling in your legs and unexplained weight gain are not minor inconveniences. They can be early signals of a heart that is struggling. And here is what I see happen over and over again. People hear this information, they recognize a sign in themselves, they feel concerned for about 20 minutes, and then they go back to their day and do absolutely nothing about it. I do not want that to happen to you. There is a free platform called Care Health that connects you with healthcare options in your area, cardiac screenings, blood pressure monitoring programs, even clinical trials for heart disease, and new treatments you may not have heard of yet. All you do is fill in a short form, your date of birth, gender, basic information. It takes about 30 seconds, and Care Health matches you with relevant options near you. No cost, no commitment, just information about what is actually available to you right now. Click the link in the description or point your phone camera at the QR code on screen and it opens automatically. Now back to the warning signs your body may be showing you because we are not done. The sixth warning sign is a cough that will not go away. Not a seasonal cold, not allergies, a dry, persistent, nagging cough that lingers for weeks, sometimes months, and does not respond to anything you throw at it. Cold medicine does nothing. Antibiotics clear nothing. Allergy pills make no difference. You go to your doctor, maybe twice, maybe 3 times. You get another round of antibiotics for a suspected chest infection. It still does not clear. Here is why. The mechanism is the same one we discussed with breathlessness. When the left side of the heart cannot pump blood forward efficiently, blood backs up into the pulmonary veins and pressure builds inside the lungs. That elevated pressure forces fluid into the airways and irritates the delicate tissue lining them. Your body responds the only way it knows how. It coughs. It is trying to clear something that no amount of coughing will fix, because the problem is not in the lungs. It is behind them in the heart. In some cases, the cough produces a white or pink-tinged frothy sputum. That pink tinge is not an infection. That is a small amount of blood-stained fluid being pushed into the air sacs from the congested pulmonary vessels. If you have been coughing for weeks and nobody can explain why, if the cough gets worse when you lie down at night, if it has survived multiple rounds of treatment without improvement, stop asking what is wrong with my lungs. Start asking what is happening with my heart. That single shift in the question can change everything about where the investigation goes and what it finds. The seventh warning sign is fatigue, but not ordinary tiredness. Not the kind where you had a long day and need an early night. This is a different animal entirely. You sleep 7 or 8 hours and wake up feeling like you did not sleep at all. Getting dressed in the morning feels like a project. Walking to the mailbox and back leaves you needing to sit down. Tasks that should require no thought, no effort, suddenly demand everything you have. Here is the physiology. When your heart cannot pump enough blood to meet your body's demands, your body is forced to make choices. It begins to triage, exactly the way an emergency room triages patients. Blood flow gets diverted away from systems the body considers non-essential in a crisis, your skeletal muscles, your skin, your digestive tract, and redirected toward the organs it cannot afford to lose. Your brain, your kidneys, your heart itself. The result is that your muscles are being starved. They are not receiving the oxygen and the nutrients they need to contract and recover normally. Every movement costs more energy than it should, because the fuel delivery system is running at a fraction of its capacity. People blame this on getting older. They blame it on poor sleep, on depression, on low thyroid, and all of those can cause fatigue. But cardiac fatigue has a very specific quality that separates it from the rest. It gets worse with even mild physical activity, and it does not improve with rest. Normal tiredness responds to a good night of sleep. Cardiac fatigue does not. If rest is no longer restoring you, that is not a lifestyle problem, that is a circulation problem, and your heart is the pump. The eighth warning sign surprises most people because it has nothing to do with the chest. It shows up in your stomach. You sit down to eat, and after 2 or 3 bites, you feel full. Not satisfied. Full. Like you already had an entire meal even though you barely started. Or you feel bloated, nauseous, completely uninterested in food for no obvious reason. Some patients describe a dull, heavy ache in the upper right side of their abdomen that nobody can explain. They assume it is a stomach problem. They take antacids. They change their diet. They get referred for an endoscopy. Nothing turns up. Here is what is actually happening. When the heart cannot pump blood forward efficiently, blood backs up. We already covered what happens when it backs up into the lungs, but it also backs up into the liver and the digestive tract. The liver sits in the upper right portion of your abdomen, and it receives an enormous volume of blood flow. When venous pressure rises because the heart is struggling, blood pools in the liver. The organ becomes congested and swollen. A swollen liver presses against the surrounding tissue in the stomach, creating that sensation of fullness and that dull ache beneath the ribs. At the same time, the gut itself is receiving less oxygenated blood because cardiac output has dropped. A gut with poor blood supply does not digest well. It does not signal hunger normally. It protests with nausea and bloating. I have seen patients spend months cycling through gastroenterologists, trying elimination diets, taking acid blockers, and none of it helps because the problem was never in the stomach. The stomach was responding to a heart that could not keep up. If your appetite has disappeared and nobody can explain why, the answer may not be in your digestive system, it may be in your chest. The ninth warning sign is the one that frightens people the most, and it is also the most commonly misread. You start forgetting things. Not the ordinary kind of forgetting where a name slips your mind for a moment. The kind where you walk into a room and genuinely cannot remember why you are there, where you lose track of a conversation halfway through, where your thinking feels slow and clouded, like your brain is working through fog. Family members may notice it before you do. You seem confused at times. You repeat yourself. You struggle to make decisions that used to come easily. In older adults, this pattern is almost universally attributed to one of two things: normal aging or the beginning of dementia, and in some cases it is neither. Here is what may actually be happening. The brain is the most metabolically demanding organ in your body. It weighs roughly 2% of your total body weight, but consumes about 20% of your oxygen and a quarter of your glucose. It requires a constant, uninterrupted supply of blood. When cardiac output drops, the brain is among the very first organs to feel the deficit. It does not get enough oxygen, it does not get enough fuel, and it begins to underperform. Doctors call this reduced perfusion, meaning insufficient blood delivery to the tissue. The distinguishing feature is fluctuation. Cognitive symptoms caused by heart failure are not fixed. They come and go. They worsen during physical exertion or on days when fluid overload is at its worst. They improve on better days when the heart is coping more effectively. Dementia does not fluctuate like that. If the mental fog lifts on some days and descends on others, and that pattern tracks with how physically drained you feel, the problem may not be your brain at all. It may be the pump that feeds it. Now I want to be very clear about something. No single sign on this list, taken by itself, is a diagnosis. Shortness of breath can be poor fitness. Swollen ankles can be standing too long. Fatigue can be low iron. Every one of these signs has other possible explanations, and I do not want you to panic because you recognized one of them. What matters is the pattern. When 2, 3, or more of these signs show up together, or when they develop over the same stretch of time, that changes everything. Let me walk you through what this looks like in real life. Imagine someone, maybe it is you, maybe it is someone you care about. 6 months ago, they noticed they were getting more winded climbing one flight of stairs. They blamed it on not exercising enough. Around the same time, they started sleeping with a second pillow because lying flat felt uncomfortable. They assumed it was acid reflux. A few weeks later, their ankles started looking puffy by evening. They figured it was the heat or too much sitting, and underneath all of it, a fatigue that never lifts. 8 hours of sleep and they still wake up drained. They blamed it on age. Each sign individually got a reasonable explanation. Each one got dismissed, but line them up side by side and the picture is unmistakable. That is not 4 separate problems. That is one problem, showing itself in 4 different ways. Here is what I want you to do. Take a piece of paper right now. Write down which of these 9 signs you recognize in yourself or in someone close to you. Do not rely on memory. Write them down. Bring that list to your doctor at your next visit and say, I want to talk about these. Do not wait for the signs to get worse. Heart failure caught in its early stages, when the heart is just beginning to struggle, is far more treatable than heart failure caught years later after the body has exhausted every way it knows to compensate. Early is not overreacting. Early is the entire strategy. Let me bring it all together. 9 warning signs. Shortness of breath during activities that never used to bother you. Waking up at night gasping for air. Needing more pillows to breathe comfortably while lying flat. Swollen ankles and legs that leave a dent when you press them. Sudden unexplained weight gain over days. A persistent cough that does not respond to any treatment. Fatigue and weakness that rest cannot fix. Loss of appetite and nausea with no digestive explanation. And confusion or mental fog that comes and goes. Heart failure is not a lightning bolt. It is a slow, gradual process, and your body warns you every step of the way. The signs are not dramatic. They are quiet. They are easy to dismiss, and that is precisely what makes them dangerous. The question was never whether your body would tell you. It always does. The question is whether you listen and whether you act. Write down your signs. Bring the list to your doctor. Ask the questions nobody else is going to ask for you. And remember, that free health screening link is still in the description. 30 seconds could connect you with cardiac screenings and options you did not know were available near you. Take care of yourself.